Have you ever stood up from your chair, felt the room spin for a few seconds, and told yourself, "I'm probably just tired," or "I must not have had enough water today"? Maybe your vision became blurry for a moment, or your words did not come out quite right. Most people brush these moments aside because they disappear so quickly. But what if those brief episodes were not random at all? What if your brain had been warning you for days that something much more serious was on the way? What surprises many people is that a large percentage of people who suffer a major stroke actually experience warning signs beforehand. Those warning signs often come and go so quickly that they seem harmless, which is exactly why they are so easy to ignore. Stay with me until the end because I am going to show you a simple daily check that can help you recognize these warning signs before they become something much more dangerous. I'm Dr. James Smalls, a cardiovascular and neurological health specialist with more than 18 years of experience treating adults over 60, and I have seen far too many families say, "We wish we had known sooner." The truth is, this is not something most people hear during a routine doctor visit. Office appointments are often focused on today's symptoms, medications, and test results, leaving little time to explain the subtle warning signs that can appear days before a stroke. If this information sounds valuable already, please take a moment to like this video. It helps us reach more adults over 60 who deserve to recognize these warning signs before they become an emergency. Think of your brain like a large neighborhood filled with thousands of homes. Every home depends on clean water flowing through pipes every minute of every day. If those pipes become blocked, even for a short time, some homes stop receiving what they need. Your brain works much the same way. Healthy arteries deliver oxygen-rich blood to every part of the brain every second. That steady flow allows you to think clearly, move your arms and legs, recognize faces, speak, remember names, and keep your balance without even thinking about it. When blood flows smoothly, your brain quietly does its job without asking for your attention. But after 60, those arteries often become less flexible. Years of cholesterol buildup, high blood pressure, diabetes, smoking, or simply aging can allow fatty plaques to slowly narrow the inside of blood vessels. This usually happens without pain. You cannot feel plaques growing. You cannot hear blood flow slowing down. Everything may seem perfectly normal until one day, the blood supply becomes interrupted, even briefly. That is why today's topic matters so much. In this video, I'm going to walk you through 7 warning signs that may appear before a major stroke. Sudden dizziness or loss of balance, changes in vision, numbness or weakness on one side of the body, sudden confusion, changes in speech, an intense thunderclap headache, and perhaps the most important warning sign of all, a mini-stroke, also called a transient ischemic attack, or TIA, that disappears and is often ignored. By the end of this video, you'll know what each of these signs may mean and exactly what simple daily check I recommend to help recognize them early. Let's begin with the warning sign that many people dismiss first. A transient ischemic attack, or TIA, is often called a mini-stroke. I actually don't like that name because it makes the condition sound small or harmless. In reality, it is your brain's emergency warning signal. Imagine someone stepping on a garden hose. Water still comes through, but only for a moment before the pressure drops. Then the foot lifts, and the water flows again. A TIA works in a similar way. For a short period of time, blood flow to part of the brain becomes blocked or severely reduced. Then the blockage clears before permanent damage occurs. Because the symptoms disappear, many people assume the problem disappeared too. But the underlying cause often remains. That temporary interruption tells us the blood vessels supplying the brain are struggling. If nothing changes, another blockage may occur. And the next one may not clear on its own. This is why doctors take TIAs so seriously. A study published in Neurology, the Journal of the American Academy of Neurology, followed 2,416 people who experienced an ischemic stroke. The researchers found that warning signs were present as early as 7 days before the major stroke, and 43% of transient ischemic attacks occurred during the 7 days leading up to the stroke. That means nearly half of those warning episodes happened within 1 week before the larger event. Other research has shown that nearly 20% of people who experience a TIA will have a full stroke within 90 days, with the greatest risk occurring during the first 48 hours after the TIA. These findings remind us that temporary symptoms deserve medical attention, even when they disappear. If you're over 60 and you've ever had a symptom that lasted only a few minutes before going away, this next part is especially important. One of the earliest warning signs is sudden dizziness or loss of balance. I'm not talking about feeling lightheaded because you skipped breakfast or stood up too quickly. Stroke-related dizziness often appears without an obvious reason. You may suddenly feel as though the room is spinning. Walking in a straight line becomes difficult. You may reach for furniture to steady yourself. Some people describe feeling like the floor suddenly shifted underneath them. Because these episodes sometimes last only a few minutes, they are often blamed on dehydration, fatigue, or getting older. Sometimes they are caused by those things. But sometimes they are the brain telling you that the area controlling balance is not receiving enough blood. The challenge is that the two can feel surprisingly similar in the beginning. But before we go any further, there are 3 specific features to stroke-related dizziness that separate it from ordinary lightheadedness. Almost nobody outside a neurology or cardiology office ever learns these 3 features. I am going to tell you exactly what they are before this video ends. Write that down in your mind right now, because by the time I share them with you, everything we cover between now and then will make complete sense. Several months ago, I met a 74-year-old retired school bus driver from Columbus, Ohio. His name and details have been changed to protect his privacy. He told me that every few days he would suddenly lose his balance while walking from the kitchen to the living room. The feeling usually lasted less than 5 minutes before disappearing. He blamed it on getting older. His wife thought he simply wasn't drinking enough water. For nearly 2 weeks, he ignored the episodes because each one ended as quickly as it started. When he finally came into my office, we talked through each episode carefully. The pattern immediately concerned me because the dizziness appeared suddenly, without warning, and was not connected to standing up, missing meals, or changing medications. Further evaluation suggested he had likely experienced transient ischemic attacks. Thankfully, he received treatment before suffering a major stroke. As he looked at me after we discussed what had been happening, he quietly said, "Doctor, I honestly thought getting dizzy was just part of turning 74. I had no idea my brain could have been asking for help." That conversation is one I have had with far too many patients over the years. In the next part, I'm going to explain why one common habit that many adults over 60 believe completely protects them from stroke may not be enough by itself. And then I'll finally show you the simple pattern that separates ordinary dizziness from the kind that deserves immediate attention. Before we move on, I'd like to ask you a simple question. If you're over 60, have you ever had a sudden dizzy spell that came out of nowhere and disappeared after a few minutes? Type yes or no in the comments below. I read as many of your comments as I can, and they also help other viewers realize they are not alone. And stay with me, because I still owe you the simple way to recognize the dizziness pattern that may point to a stroke warning rather than an everyday balance problem. Now let's talk about one of the biggest misunderstandings I hear in my office. Many adults tell me, "Doctor, I take a baby aspirin every day, so I don't have to worry too much about stroke." I understand why people think that. For many years, aspirin was widely viewed as something almost everyone over 60 should take to protect the heart and brain. But today, we know the answer is much more personal than that. The 2024 American Heart Association and American Stroke Association guidelines make it clear that stroke prevention should be based on each person's individual risk. Aspirin can absolutely be the right choice for some people, especially those who have already had certain heart or blood vessel conditions. But it is not a guarantee that a stroke cannot happen, and it is not the right preventive medicine for everyone. That means the goal is not to stop taking aspirin on your own. The goal is to make sure you and your doctor know why you are taking it, whether it is still the best choice for you, and what other risk factors also need attention. Think of it this way. Imagine your house has 6 doors. Locking only one door makes your home safer, but it does not secure every entrance. Stroke prevention works much the same way. Managing blood pressure, keeping cholesterol under control, treating diabetes, staying physically active, not smoking, getting enough sleep, knowing your warning signs, these all work together. Aspirin may be one part of the plan for some people, but it is only one piece of a much larger picture. This is especially important if you're over 60 and you've ever experienced one of the warning signs we're discussing today. The safest next step is not guessing at home. It is reviewing those symptoms with your healthcare provider so your overall stroke risk can be evaluated. Now let's move to another warning sign that many people dismiss. Changes in vision. Sometimes a stroke warning begins with one eye suddenly becoming blurry. Other people describe a gray curtain moving across part of their vision. Some temporarily lose vision in one eye. Others notice double vision that suddenly appears and then disappears. Because these episodes improve quickly, people blame dry eyes, fatigue, new glasses, or spending too much time looking at a screen. But when blood flow briefly decreases to the areas that control vision, or to the eye itself, those short-lived changes may be your brain asking for attention. Another warning sign is sudden numbness or weakness, especially on one side of the body. This is one of the classic stroke symptoms. Your arm may suddenly feel unusually heavy. Your leg may seem difficult to move. You may notice one side of your face feels different when washing it or brushing your teeth. Even if the weakness disappears after a few minutes, it should never be ignored. Then comes sudden confusion. A person who is thinking clearly 1 minute may suddenly struggle to follow a simple conversation. They may know what they want to say but cannot make sense of the words someone else is speaking. That confusion often clears. Which is why families sometimes assume the person was simply distracted. Closely related to confusion is another warning sign: changes in speech. Some people begin slurring their words. Others substitute the wrong word without realizing it. Family members often notice it before the person speaking does. If your loved one suddenly sounds different, even for only a few minutes, that change deserves medical attention. Another warning sign is a sudden, severe headache unlike anything you've experienced before. Doctors sometimes describe this as a thunderclap headache because it reaches maximum intensity very quickly. Not every severe headache is caused by a stroke, but a sudden headache that is extremely intense, especially if it appears alongside other neurological symptoms, should never be brushed aside. I want to tell you about another patient I treated some time ago, a 76-year-old retired librarian from Portland, Oregon. Her name and identifying details have been changed to protect her privacy. And her story is exactly what I described at the very beginning of this video: warning signs that appeared before anything serious happened, that felt harmless in the moment, and that disappeared completely on their own. This is what your brain's warning system actually looks like in real life. And it is far quieter than most people expect. She came to see me after something unusual happened twice in the same month. The first time, she was reading a newspaper when the words suddenly became blurry in her right eye. Within about 10 minutes, her vision returned to normal. She assumed she needed stronger reading glasses. A week later, she was talking with her daughter on the phone when her speech suddenly became difficult to understand. Her daughter immediately asked if she was feeling all right. But within a few minutes, she was speaking normally again. She almost canceled her appointment because she felt completely fine by the following morning. As she described both episodes, something stood out immediately. Each symptom had appeared suddenly. Each one lasted only a short time. Each one completely disappeared. Together, they formed the exact pattern I worry about because they strongly suggested transient ischemic attacks rather than unrelated problems. We arranged further evaluation, and fortunately, she received treatment before experiencing a major stroke. As we finished talking, she looked at me with tears in her eyes and quietly said, "Doctor, why didn't anyone tell me sooner?" I hear that question more often than I wish I did. The good news is that once you understand these warning signs, you don't have to rely on memory alone. In the next part, I'm going to show you the Be Fast Daily Check, a simple routine you can do in just a minute or two without buying any equipment. It also answers the question I promised earlier: how to recognize the dizziness pattern that deserves medical attention instead of simply assuming it's dehydration or getting older. Now let's close the loop I promised earlier. I told you there is a pattern to stroke-related dizziness that many people never learn to recognize. The easiest way to remember it is with something I call the Be Fast Daily Check. It takes less than 2 minutes, costs nothing, and requires no special equipment. It is not meant to diagnose a stroke. Instead, it helps you notice changes that should never be ignored. 1. Balance. Each morning, take a few normal steps across a room. Ask yourself, do I suddenly feel off balance today compared to yesterday? If dizziness appears suddenly without an obvious reason or makes it difficult to walk normally, don't simply assume it is dehydration or age. A sudden change deserves medical attention. 2. Eyes. Cover one eye, then the other. Notice whether your vision is clear in each eye. Look for sudden blurriness, double vision, or a dark area that was not there before. Even if it lasts only a few minutes and then disappears, it should be reported to your doctor. 3. Face. Smile naturally while looking in a mirror. Check whether both sides of your face move evenly. A drooping mouth or one side that doesn't move normally may signal a problem affecting the brain. 4. Arms. Hold both arms straight out in front of you with your palms facing upward for about 10 seconds. If one arm drifts downward, feels unusually weak, or is difficult to keep raised, do not ignore it. Sudden weakness on one side is one of the most recognized stroke warning signs. 5. Speech. Say one simple sentence out loud each day, such as, "Today is going to be a good day." Listen carefully. If your words suddenly become slurred, difficult to pronounce, or someone tells you that you sound different, take that seriously even if your speech returns to normal a few minutes later. 6. Time and track. If you notice any of these changes, write down exactly when they started, how long they lasted, and what you were doing. Then contact emergency services immediately if the symptoms are happening now or if they return. If the symptoms have completely resolved, contact your healthcare provider promptly the same day for guidance, because a temporary episode can still be a warning sign. Keeping a simple record also helps your doctor understand exactly what happened. If you've been waiting for the answer about dizziness, here it is. The dizziness that worries me most usually has 3 features. First, it comes on suddenly rather than building slowly. Second, it is different from your usual dizziness. Patients often tell me, "I've never felt anything quite like that before." Third, it may happen along with another warning sign, such as blurred vision, weakness, numbness, slurred speech, or confusion. One symptom by itself does not automatically mean a stroke. But when sudden dizziness appears with one or more of these other signs, especially after age 60, it should never be dismissed as simply getting older. And remember the research we discussed earlier. Studies show that nearly 20% of people who experience a transient ischemic attack go on to have a stroke within 90 days, with the highest risk during the first 48 hours. The Mayo Clinic also notes that about 1 in 3 people who have a TIA later experience a stroke, with the danger again being greatest in the first 2 days. That is exactly why recognizing these warning signs matters. Everything I shared with you today is real, practical, and something you can begin using right away. If you start doing the Be Fast daily check tomorrow morning, you'll already be paying closer attention to your brain's warning signals than many people ever do. But here's something I've learned after more than 18 years of caring for adults over 60. A typical doctor's appointment lasts around 12 minutes. In that short amount of time. It's called the Early Stroke Warning Guide by Dr. James Smalls. Inside the guide, you'll find a printable weekly Be Fast tracking log that makes it easy to record symptoms if anything unusual happens. You'll also find a simple guide that explains which symptoms mean you should seek emergency care immediately, which situations call for contacting your doctor the same day, and which symptoms should simply be monitored and discussed during your next routine appointment. Finally, I've included a list of important questions you can bring to your healthcare provider if you've already experienced dizziness, vision changes, numbness, speech problems, or any of the other warning signs we discussed today. Many people tell me they forget what they wanted to ask once they arrive at the office, so having those questions written down can make the conversation much more productive. If you think that would be helpful for you or someone you love, you'll find the Early Stroke Warning Guide by Dr. James Smalls linked in the description below. It's there whenever you're ready. Before we finish, let's review the 7 warning signs one more time. Sudden dizziness or loss of balance, sudden changes in vision, numbness or weakness on one side of the body, sudden confusion, slurred or changed speech, a sudden severe thunderclap headache, and finally, a transient ischemic attack, a mini-stroke that seems to go away but should never be ignored. These signs are not meant to frighten you. They are meant to help you recognize when your brain may be asking for medical attention before a larger problem develops. This is not fear. This is information. If you're over 60 and you've ever experienced even one of these symptoms, I encourage you to begin the Be Fast daily check starting tomorrow. Share it with your spouse, a close friend, or another family member so they know what to watch for as well. Sometimes the people around us notice these changes before we notice them ourselves. If you found today's video helpful, please give it a thumbs up, subscribe to the channel, and turn on the notification bell so you don't miss future videos on protecting your heart and brain as you age. And drop a comment below right now telling me which of these 7 warning signs surprised you the most. I read every single one, and your comment helps other viewers over 60 find this video before it matters most. And if you know someone who is over 60, consider sharing this video with them on WhatsApp. One simple conversation today may help someone recognize a warning sign they would have otherwise ignored. If you'd like an easy reference to everything we discussed today, don't forget that the Early Stroke Warning Guide by Dr. James Smalls is available through the link in the description. Thank you for spending this time with me. I'm Dr. James Smalls, and as always, take good care of yourself and the people you love. Contact your local emergency services or your physician immediately. Early evaluation can make a critical difference. Medical disclaimer: this video is for educational purposes only and is not a substitute for personalized medical advice, diagnosis, or treatment. All patient names and scenarios presented in this video are fictional and are used only to help explain medical concepts. If you experience sudden dizziness, vision changes, numbness, weakness, confusion, slurred speech, a severe sudden headache, or any other possible signs of stroke,